You're at the doctor's office. The technician's in the room with you, and you see this picture on the monitor. The technician says, "It's a boy," or maybe they say, "It's a girl." You don't care, you're pregnant. They then say, "Listen closely." You hear a thud, 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 thud. You've just heard the first heartbeat of your baby. They then hand you a picture at the end of the appointment, and you realize this is the first picture that you will have of your child. It's the best day for you. It's not the same scenario in the room next to you. A woman has been called back in after some tests done the week prior. The technician's in the room, and the doctor shows her this picture on the screen. The doctor confronts her and says, "You have cancer." She blurts out, "I can't, I'm only 35. Her feelings and emotions are as deep and dark as that cancer on the screen. The same procedure done on two different people, and two completely different outcomes happen. You may be asking, what are they having done? What procedure? Well, they're getting an ultrasound, which is part of the diagnostic medical sonography field. As the baby boomer generation grows, and couples are having babies left and right, the diagnostic medical sonography field is rapidly growing. The U.S. Bureau of Labor and Statistics expects a 44% growth in this field between 2010 and 2020. As you can see, in 2010, 53,700 jobs were held in this field. They expect that by 2020, 77,100 jobs will be held. There's not only a rise in jobs in this field, but also in wages as well. In 2010, the median wage, or average, was $64,380. Just last year, in 2012, the median wage was $65,860. Now this is the average for this occupation. There's also a low and there's also a high. The lowest being $44,990 in 2012, and also in 2012 the highest was $91,070. This is a growing field with good pay and job security. So you may be asking, how do I obtain a job in this field? Well, to obtain a job in the ultrasound field, you either need to receive an associate's degree, bachelor's degree, or certificate from an accredited college, take the necessary exams to finalize your certification, and it is in your best interest to train in more than one concentration in the field of ultrasound. Abraham Lincoln once said, "All I have learned from books." And this is your first step. Go to an accredited college and learn from a book. The easiest way to do this is to go to the Commission on Accreditation of Allied Health Education Programs website, as you see here. As you see, I've searched by the state of Maryland, and I've left all the concentrations for diagnostic medical sonography open. Once you pick your state, you hit search. You'll be prompted to a screen that looks like this. As you can see, 3 colleges or universities are accredited in the state of Maryland, them being Johns Hopkins Hospital, Montgomery College, and University of Maryland, Baltimore County. Once you figure out if there is a school near you, you're going to figure out the program length which best suits you. If you want to go for 4 years, you will earn a bachelor's degree. If you go for 2, you'll earn an associate's, and a certificate is anywhere from 12 to 18 months. Once you find the length, you'll want to look into the curriculum. All curriculums are stated by the Commission on Accreditation of Allied Health Education Programs. Studies will include programs such as physical and applied biological sciences, patient care and clinical medicine, and applications of ultrasound, instrumentation, diagnostic procedure, and image evaluation. If these sound like classes that would interest you, then this is a field for you. But be careful. This is a very hands-on education and occupation. We all know what happens when we finish school, a final exam. That's your next step. After finalizing at your accredited college, you need to take the necessary exams to finish your certification. One of the places where you can take an exam for diagnostic medical sonography is the American Registry of Radiologic Technicians. You will want to apply to take this exam at least 3 months prior to your anticipated graduation date. We all know final exams are long. This one is long. 7.5 hours to finish this exam. Don't be worried though if you don't do well your first time. You have 3 times to take this exam. The only stipulation is that you must complete those 3 tries within a 3-year period. So, You finished at your accredited college, you've taken all the finals necessary. Now you want to go earn that salary. Well, Dilbert's salary theorem states, the less you know, the more you make. This is not true with ultrasound. Ultrasound has many different credentials or specialties that you can earn, such as abdomen, breast, OBGYN, which deals with pregnancies and babies, adult, fetal, and pediatric echocardiograph, which deals with the heart, and vascular, which deals with blood vessels. Many sonographers find they're more marketable if they have more than one credential. Take a hospital, for example. It would take 3 people to fill 3 different of these credentials if each one is only certified in one. If you are certified in 3, you as one person can take their 3 spots. You'd get hired before them. They also feel they can gain a higher salary, which is always a good thing. So you've finished school, you've taken the exams, you've certified in your specialties, so go out there and get some cash. You know you'll have job security as there is expected a 44% increase in growth rate, and you know there's a higher pay as well. It's not significantly time-consuming for this degree. Some certifications are only 1 year, and for a 1-year degree, it pays fairly well. So if this interests you, then get to the nearest accredited school and get your degree. A saying by a current sonographer says it all. I teach, I'm taught, I do, I adapt, I think, and I'm physically active. You can't say that about many jobs.